Il y en a combien? Ils sont nombreux, hein?
Cameroun, mais c'est la représentante de la première dame.
Ok. Mesdames et messieurs,
ladies and gentlemen, could you please get on your feet in order to welcome His Excellency Mr. Mamadou Issoufou, President of the Republic of Niger, and His Excellency Christian Kabore, President of the Republic of Burkina Faso.
le président,
His Excellency Mr. Idriss Déby Itno, President of the Republic of Chad, will also be with them.
veuillez vous asseoir, s'il vous plaît.
Could you please take your seats?
Merci, Monsieur les
Thank you very much, photographers and members of the media. Could you please take your seats so that we can start?
Mesdames et messieurs,
Ladies and gentlemen, would like to inform you that simultaneous interpretation is available in English and in French. So you can listen to these two languages as you may through your earphones. Your Excellencies, the President of the Republic of Niger, Burkina Faso, and Chad, His Excellency Dr. Lala Malika Issoufou, First Lady of Niger, Honorable First Ladies of Mali, Burkina Faso, Gambia, DRC, Chad, Sierra Leone, Zimbabwe, Kenya, a representative of the First Lady of Cameroon is here with us as well. It is a great honor and pleasure for me to welcome you to this high-level conference on cancer organized by the Ministry of Public Health of Niger in conjunction with the Tatali Iyali Foundation of the First Lady of Niger and in partnership with the World Health Organization, the UN Fund for Population, and the Alliance of Francophone and Mediterranean League on Cancer Control.
Thank you to His Excellency, the President of Niger, for hosting us. Le cancer
Cancer is not a disease for the rich. Cancer is not a disease of the white man. It is a disease that affects all countries and is becoming a scourge that is increasingly besetting African countries, especially. On our continent, according to WHO, 18 million deaths were recorded in 2018 throughout the world, but contrary to other regions of the world, the rate of death in Africa is higher than those linked to other diseases because of the limited access to diagnosis services and expedient treatment in our countries. Unfortunately, this disease has not become a priority when it comes to public health in most African countries. Our meeting today is aimed at changing all this. And we want to get the commitment of the highest level of political authorities, heads of state who are present here, our first ladies, financial and technical partners, in order to make the fight against cancer a priority of our national health policies in African countries aligned to the 2030 agenda for sustainable development. We want to highlight the practices and experiences of the different countries. And this meeting must mark a decisive pace, a turning stone in this fight against cancer, because cancer should not be a fatality. Without any further ado, allow me to give the floor now to His Excellency, the President of the Republic of Niger.
à qui mon collègue
Excellence,
Your Excellency, Mr. Mahamadou Yusufu, President of the Republic of Niger. Your country, Niger, is a champion when it comes to the free management of diseases, and especially with respect to cancer patients. Moreover, in your country, patients who are suffering from cancer represented the majority of patients that were being sent abroad for treatment. And today, you are implementing a national cancer control plan, and you have a general reference hospital that gives quality treatment to cancer patients, Your Excellency. Could you tell us how you indeed managed to achieve this?
On fait ça là-bas. On répond là-bas. Bien, je vous remercie.
I would like to thank you very much for your question. In response to that question, I would first of all make a general comment before, well, a specific comment on cancer. In Niger, we consider that health is an essential issue. Investing in health is to invest in the economic and social development of the country, because our citizens who are in good health are citizens that are productive as well as competitive. And this is the reason why the Renaissance program that I've been implementing for the past 8 years has made health one of its 8 priorities. And in this program, we have planned to invest in health 10% of our budgetary resources. It is planned, it is being done up to the level of 10% for the past 8 years. And our objective, of course, is to achieve universal health coverage. Our objective is to fight communicable and non-communicable diseases. And in that context, we have a whole infrastructure, health districts, integrated health centers of type 2, that is with maternities, and the transformation of these type 1 integrated centers into type 2 centers. We have also built the modern departmental hospitals. And as you mentioned in your question, during this past 8 years, we have indeed built 2 reference hospitals, one in Niamey, the other one in Maradi. That in Niamey has become operational already. The one in Maradi will soon become operational. So we're making a lot of effort from the point of view of infrastructures. We're also making a lot of efforts in the area of recruitment of staff. And this is very important if we want to achieve this objective of universal health cover. And then there's the problem of medication, drugs, which is at the center, at the very hub of our health program. So all this is just to say that all the pathologies that are very mortal in Niger, be it malaria, be it tuberculosis, but especially cancer. Cancer in our country is a real problem of public health. And this is the reason why we have decided to focus, and if I dare say, to indeed wage a real war against cancer. We have established a cancer control center, which has not yet become quite operational. Some of it has become, like the part concerning chemotherapy, I believe. And we are trying to procure some equipment in order to get equipped for radiotherapy, etc. So we are fighting against this horrible disease, which indeed poses a lot of suffering, a lot of pain, a lot of concern, not only to the patients themselves, but also to their families and relations, their families. So this is the reason why, in fact, when it comes to giving free health care, because this question also touched on this issue of free health care, cancer, especially gynecological cancer, is treated free of charge in our country. There are other measures of this free care that we're trying to implement for children from 0 to 5 years old, free health care for cesarean operations, free health care that are targeted. I talked about malaria a while ago. I could also have mentioned HIV, AIDS. I could also have mentioned tuberculosis, etc. And we're investing a lot of resources in the area of free health care. And finally, what I would also like to add is that we're in the process of progressively equipping ourselves. The case of the Niamey Reference Hospital is proof of this. Our aim is to reduce our health evacuations abroad. We invest 10 billion CFA francs in health-related evacuations abroad. But since we had the Niamey Reference Center, we've invested more than 3 billion. You can imagine we have saved about 3 billion, I mean. So we're going to make operational the Maradi Reference Hospital. We have a project, and our reference hospital, another one in Tawa, and we are not also losing sight of the objective of having another reference hospital in Zenda. So very gradually, Niger is getting equipped. Niger, as I've said at the beginning of my intervention, is making health its priority, because our citizens in good health are citizens that are productive, and they are citizens who are competitive. And this is the answer that I have to your question. Thank you very much. Thank you very much, Mr. President.
Merci beaucoup.
I thank you very much, Mr. President. Now we are going to give the floor to the President of Burkina Faso, His Excellency Mr. Roch Christian Kabore. Your Excellency, following the Ouagadougou appeal that was launched on the 24th of November 2017 in cancer, followed the high-level meeting on the promotion of the sensitization on cancer and advocacy programs in African countries, members of the OIC, on the 1st and 2nd of August 2019. Can you tell us about the progress that you have made in your country, Burkina Faso? Thank you.
Monsieur le Président de la République,
Your Excellency, the President of the Sister Republic of Niger, Your Excellency, the President of the Republic of Chad, Madam, the First Ladies, all ladies and gentlemen, I would like to say that, first of all, the issue of the fight against cancer that we are discussing today is indeed a very essential problem for the health of the populations in our countries and also for the economic and social development of our countries. I would also like to say that since 2016, we have decided in Burkina Faso to indeed do free screening for cancer and also treat free of charge pre-cancer lesions. And this is to say that we were aware and conscious that it is women who are carrying the heaviest burden as far as this disease is concerned. And this is why, after the various meetings that you have just mentioned, be it the ministers, YMO ministers of health meetings, or the First Ladies conference under the aegis of the OIC, a certain number of efforts have been made in our countries. First of all, by the first quarter of the year 2020, the Center for Cancer Treatment and the units that will be responsible for radiotherapy will be established in Burkina Faso. And this will enable us to treat this disease locally. Secondly, under the YMO, that meeting decided that we should ensure that cancer patients can be treated in our various countries without discrimination. And this means that somebody who is a patient of cancer can be treated in Côte d'Ivoire, in Burkina Faso, in Niger, etc., at the same price as the local heads of state that will take place on the 12th in Côte d'Ivoire. And YMO will ensure that this quickly becomes a reality. We also believe that in the case of the African Union, generally speaking, it is something that we need to investigate in order to enable the patients to benefit from this treatment, no matter where they are in Africa. And secondly, we also have taken some measures concerning the anti-smoking control, because you know that cancer is also due to smoking. So we want to reinforce our legislations in this area and ensure that in our countries we can smoke less. And thirdly, I would also like to add that with the International Telecommunications Union, we have set in place a system for sensitization via telephones so that preventive measures against cancer can be spread through the mobile process. And I think that this is a procedure that is also being implemented. The discussions that we're having with a certain number of laboratories enables us not only to work in the area of sensitization, but also we also are working towards reducing the price of medications for cancer treatment. And I want to make an appeal so that under the African Union, we can constitute a very robust lobby in order to get laboratories to reduce the price of products that are used for cancer treatment. And this is just to say that in any case, with the OIC, we introduced a file so that we can have mobile vehicles for treatment, but not only for treatment, but also for the treatment of cancer and also the prevention that we can do through these vehicles. And we are going to receive these vehicles for the 13 regions in Burkina Faso. So this is just to tell you that some progress is being made, but it's also to tell you that it is only by acting in solidarity that we can, of course, achieve optimal solutions in the case of this fight against cancer. Every country, of course, is making an effort in the area of health, but I believe that if Africa unites under this matter, and if at the level of states we take into account this matter of cancer, we can indeed achieve qualitative progress, generally speaking. So this is what I can add very quickly. And I would like to appreciate once again the First Lady of Niger for this initiative that she has taken around the matter of cancer. Thank you very much.
Merci beaucoup.
Thank you very much, Your Excellency. The President of the Republic of Burkina Faso. Allow me to call to the podium His Excellency Mr. Idriss Déby Itno, President of the Republic of Chad. Chad, which among its priorities for health has included the fight against cancer. Your Excellency, could you also kindly tell us just a little bit more about this program that you are carrying out in Chad, and especially the major measures that you have undertaken in order to revert the trend? Your Excellency, you have the floor.
Merci, chers collègues.
Thank you, dear colleagues and First Ladies, ladies and gentlemen, the organizing team, good afternoon. First of all, let me express my pleasure at the holding of this meeting on the theme, the pathology, the issue of pathology, which today, at the continental level, and not only at national levels, is unfortunately affecting the public health of our populations. And before I move on to the specific issue of cancer, let me tell you the activities that we have conducted over the past 15 years in the area of public health, which is the second priority in our country, such that at the end of each month, let's say 24th of each month, I personally chair a meeting in the presidency, including national stakeholders and all the partners, to take stock of the situation in relation to public health. And that is done in the regions of the country as well. On the 15th of every month, in the 23 provinces of Chad, the government chairs a a meeting, and in all these 23 meetings, after that we come back to hold the meeting on 24th, which I chair, and we've come up with infrastructure, extensive infrastructure. We have built more than 23 regional hospitals that which have over 100 beds. We have in the prefectures 60 district hospitals, and we have also built in the sub-prefectures 80 healthcare centers. 3 days ago, we launched the construction of a new hospital of 1,000 beds. In spite of our budgetary constraints, and in addition to the terrorist threats, which is taking up a lot of our resources, we are still able to maintain the level of investment in each year's budget. And we are attempting to get to 15%, to reach out to 15%. In 2018, we were able to reach 12%. Unfortunately, 2019, we went back to 8% on account of the security context within which we are operating. So the most important issue, which is to have hospitals, is good. But then we also need trained staff. I think I have some doctors who are training here in Niger. We have sent 300 doctors to Cuba to train. 150 of them will graduate in July, that is the end of this month. And they are specialists. 100 medical doctors between Sudan and Turkey. In addition to that, we also have training. We conduct training in N'Djamena since 2013. Each year, there are medical doctors who graduate after a 7-year course, and we have trained about 500 medical doctors. The issue of public health is crucial. Well, of course, training the human resources is good, but to have the technology, new technology, is still good. But the main issue, which we are confronting in Africa today, is what the president of Niger, Yusufu, said, is the possibility of not being able to treat certain diseases, and in each year's budget we have to provide for evacuation outside the country, and that is extremely expensive. And very often it is not to Africa, but to Europe, to countries that have the capacity. That absorbs a lot of our resources, but I think that is what we in Africa, particularly in the African Union, need to focus on, to look at the resources that Africa has to enable Africans to be treated in Africa. We need to create in Africa centers of excellence that will enable Africans to be treated on the continent. I think that is an important issue that we need to take into account. There are a lot of diseases which affect African populations, particularly that part of Africa that I know best, Chad. Here we are talking about cancer. There's also malaria, which kills more. There's the HIV/AIDS. There's the guinea worm. Which comes periodically, but it's also a disease that is not eradicated in Chad or even Africa. The other important issue.
Il faut savoir d'abord qu'il y a un engagement très fort.
We first need to know that there is a strong commitment, as far as we are concerned, commitment to the health sector. All health issues are systematically monitored and chaired by I myself on the 24th of each month, as I said, and we have figures to back this. So progressively, a dynamic network is being established which supports the public action through sensitization campaigns and caravans that go across the country, not just to treat, but also to sensitize our population. Generally, these caravans are made up of Chadian doctors, but sometimes we have doctors from brother countries like Senegal, Egypt, Sudan, Turkey, Saudi Arabia, Emirates, United Arab Emirates. So these are some of the activities that we are carrying out together. There is also social communication, which is one of the most important means to conduct sensitization, since we are talking about cancer, which doesn't apply only to women but men as well. But women bear the brunt. There are figures to support this. In 2012, I believe, 2012, breast cancer represented 34.9% for women, and cervix 23%, and that really is a disaster for the Chadian woman and African women as a whole. So the establishment of the Chadian League to fight cancer and other social organizations are useful, and I have said that since 2012, all care for HIV/AIDS is free. Since 2012, mother and child care is absolutely free, including cesareans. And since 2012, immunization is absolutely free in Chad. Since 2012, the screening, whatever and the disease, is free. So, to come back to cancer, the media, public media, also plays an extremely important role to be able to reach out to the hinterland of the country I think it is important for the media to play their role, and that is what the Chadian media has been doing. Further, we intend to launch in September this year the cancer register, which will complete the lack of the inadequacy of data. We're working with the WHO and the Chadian scientific community in its fight against cancer. Last year, we came up with, we launched a campaign called Rose Campaign, and it was intended to sensitize the population on cancer. We intend to replicate it every year. We have an ambitious national program to fight against cancer with the support of WHO, and I'd like to thank them in passing. And this is with the support of our own resources, our financial partners, and we have a strategic plan 2017-2021 and an annual operational plan. Screening, diagnosis, treatment are free in Chad. And the cost is exorbitant, and no one person has the resources to be able to afford these cares. So I would like to appeal from this podium to all people of goodwill, particularly our partners supporting us in the area of health, to continue and even do more. The specificity of cancer requires specific equipment as part of our investment in infrastructure and management of cancer. Echography, mammography, and the implementation of care requires qualified medical staff, which does not exist in Africa. Most of these drugs come not from the continent, but from outside, apart from one or two countries that have a pharmaceutical industry for the manufacturing of drugs. I don't think there's any African country has facilities to be able to do this. And I think it is time for Africa to be able to construct the facilities that will manufacture these drugs. There's we have plans to build a complex which will take off in the years ahead and we'll be able to manufacture some of these drugs locally. Thank you.
Merci beaucoup, Monsieur le Président.
Thank you, His Excellency, President of the Republic.
Mesdames et Messieurs,
Ladies and gentlemen, the presidents will take leave of us, but before they do, on your behalf, all of you, I'd like to thank them exceedingly for their commitment and to congratulate them for what they've done so far and their commitment to move forward. And with your support, we'll accompany them outside.
Mesdames et messieurs, merci beaucoup. Veuillez vous asseoir.
Ladies and gentlemen, thank you very much. Please take your seats and we proceed with our session. Once again, we'd like to thank the heads of states for joining us. And let's straight away give the floor to she who brought us here today, our hostess, Your Excellencies, ladies and gentlemen. Please welcome the First Lady of Niger and President of the Tata Yali Association, Dr. Lala Malika Isufu.
Bonjour. Good afternoon. My sisters, First Ladies of Africa, ladies and gentlemen, Ministers of Health, Honorable Ministers, distinguished national parliamentarians, members of the diplomatic corps, representatives of international organizations, honorable traditional chiefs and religious leaders, experts and representatives of associations and NGOs, distinguished guests, ladies and gentlemen. First of all, allow me to thank you for accepting to mark with your presence this opening ceremony for our discussions on the cancer burden in Africa. I would like to thank my husband, the President of the Republic, Head of State, His Excellency Isufu Mahamadou, who has always supported us in the fight against cancer. I would also like to sincerely thank my sisters, the First Ladies, who have done everything to be here with me. Their presence is indeed the renewed testimony of their commitment and their determination. These humanist valors, which decisively contribute to the well-being of the populations in general and to the fight against cancer in particular. I'm happy that we're all meeting here in Niger around this issue, which concerns the efforts of states, technical and financial partners, practitioners, experts, among others. I would be happier if this present symposium lead to a decisive commitment by the result in very committed pledges and commitments at the highest levels of the state. We'll have to change our look on cancer. We should not more be looked at as a fatality, as a condemnation to a certain death, because cancer can be cured and can even be avoided in so many cases. We need to change the glance that we have in Africa, because in Africa, cancer kills more than AIDS, tuberculosis, and malaria all combined. Your Excellencies, ladies and gentlemen, cancer is a global burden, so we have to get rid of this burden in order to protect not only the present generations, but the future generations. And this is why we have to mobilize our efforts in order to put an end to this human tragedy for families and all by calling everybody to the oars. The new cases of cancer in 2018 were estimated at 18.1 billion and death at 9.6 million. Indeed, 1 woman out of 10 women will develop a cancer in the course of their life, and in fact, the figures for men is also as tragic. If nothing is done to stop this trend, the number of deaths that are attributable to cancer will continue to increase. Countries that don't have adequate infrastructures and skills that are appropriate will pay a very high tribute. We don't have to relax our efforts. We cannot remain passive in the face of this human tragedy that is unfolding before our eyes. We have the imperious right to act, and to act now. The action that we are going to carry out will be in two fronts: have mass screening and develop a synergy of action among states, which could go through the association of our skills as well as our equipment. Indeed, the screening policies and prevention campaigns through mass communication should be translated into 1, the change of our lifestyles, 2, the fight against smoking, 3, immunization against hepatitis B, and of course the elimination of professional risks, etc. Ladies and gentlemen, we don't have the right to indeed succumb to fatality. This is what the government of Niger has understood by taking several initiatives in order to revert radically the trend and give hope to the patients and their families. I will mention, among other actions, the implementation of the program for non-communicable diseases, the creation of a National Center for Cancer Control, making cancer treatment free for patients and for children 0 to 5, the adoption of anti-smoking and its application decree, the introduction of free immunization against hepatitis B, etc. Now, concerning the diagnosis, Niger has a pathological laboratory since 2012 and a functional department of medicine. The medical management of patients is being done in the Cancer Center of Niger, a very modern center which has cutting-edge equipment and specialized staff. This center will also have a sub-regional calling. We owe this to the strong political will of our president, who has always been focusing on health. The result is there for us to see. I would also like to associate these thanks the partners of Niger, like the International Agency for Atomic Energy, the Islamic Development Bank, who has always been supporting us in the establishment of the center. In integrated maternities and health centers, women have free screening with respect to breast cancer, among others. And in the same context, a policy for the establishment of units and screening for cervical cancer is also being addressed. The Tatali Foundation, which I have the honor of presiding, supports government action through the organization, information, and sensitization campaigns on these matters, and especially on cervical cancer and breast cancer throughout the national territory. These campaigns have had a very strong impact because they have enabled us to significantly improve on the management and consequently reduce cancer prevalence. Your Excellencies, ladies and gentlemen, I would like to conclude by making a strong appeal to all African countries to develop a very strong cooperation with respect to the fight against cancer. I would like to urge them to indeed subscribe to the Paris Charter, which indeed defined the major axes for fighting against this disease throughout the world. Let us all work together for an Africa without cancer. Long live Africa. Thank you very much.
Merci beaucoup, Madame la Première.
Thank you very much for your commitments. Thank you. Thank you, Fuli. Another great lady. I have the honor to call to this podium Dr. Matshidiso Moeti, the Regional Director of WHO for Africa. And you can imagine how emotional I am when I am calling this lady to the podium.
Your Excellency, the First Lady of Niger, Excellencies, First Ladies of African countries who are with us today. I'll just pause so that people can use their equipment for the translation. Honorable ministers from Niger and from African countries, distinguished guests, dear partners, colleagues, ladies and gentlemen. The WHO Director General, Dr. Tedros Adhanom Ghebreyesus, who was to be with us today, as you can see from the plug behind which I'm sitting, deeply regrets that he could not come to Niamey at the last minute because he had, at the very last minute, unforeseen circumstances that prevented him. He sends his best wishes for a productive and successful conference. Every day, cancer is taking a heavy toll on individuals, on families, on communities, and on our countries. Cancer steals our hope. I think this has been very eloquently articulated by the heads of state and by the First Lady. It steals our dreams. It steals the people we love. And every year, there are nearly 1 million new cases and over 500,000 cancer deaths in the African region. By 2040, these numbers will double. And the socioeconomic costs is enormous and is hampering all the efforts that we are putting into our development. Cancer contributes to the cycle of poverty on our continent, which our presidents have resolutely said they are trying to address. We are encouraged by the investments which countries are making in cancer treatment, prevention, and control in the African region. And I think we have had the testimony of 3 heads of state who told us in detail what they are doing in investing in cancer in their countries. We have seen in a number of countries cancer treatment centers being established where the latest technologies are being made available for those people who can reach these centers. We've also seen an increase in screening and early detection of cancer in the countries. But we have to acknowledge that our region is still characterized by the late diagnosis of cancer and by poor treatment outcomes for those people who are fortunate enough to reach a center where they can have access to treatment. And this is by no means the majority of people yet. I was visiting a country once which has invested massively in a new treatment center which has been in existence for a couple of years. But the workers there, the specialists there told me that they have not seen any improvement in the treatment outcomes because the patients arrive too late. So the investment is not proving to be helpful in terms of treatment outcomes. I'm saying this simply to underline what has already been stated by the First Lady, Malika, and also by a couple of the presidents. Early screening and detection is absolutely central to realizing the investment that is progressively being made by heads of state and by countries in cancer treatment. I'd like to commend our dear leader, sister and friend, the First Lady of Niger, Dr. Malika, for your leadership, for your advocacy, for your energy, and for the work that you are doing to advance cancer prevention, control, and treatment in Niger. I also thank the other First Ladies who are present here because I know that they are working on cancer. I have attended meetings in the past in which they have stated what they are doing in the various countries. And most of all, I thank the heads of state who were with us today for their leadership and their courage in starting to invest in this disease, which sometimes seems like such a huge and very intimidating expense for our public purses. We do know that premature death from cancer can be reduced from a combination of measures which are targeting individuals and whole populations, including taxation of tobacco, alcohol, and unhealthy foods, so that we diminish the degree to which they are used by populations, prevention, early screening, and treatment and rehabilitation. And here I'm speaking to the objectives of universal health coverage, which has already been referred to by the heads of state in their statements. We believe firmly that if countries invest in health broadly, and we prioritize within the essential services in health the needs of cancer, we will be able to address this problem in the same way as we are addressing the other priority health problems in the African region. So we in WHO strongly promote universal health coverage as a principle, as an approach, and as a way to address equity, because the services that are being discussed here today need to be scaled up so that people in all corners of a country can be prevented, first of all, from the major risk factors, can be screened, and if they have a cancer, they can have it detected early and can have access to treatment in the same way as somebody who lives in the capital city does. That means we have to decentralize the essential services that are needed for prevention, treatment, and management of cancer. It has already been said very eloquently how cancer can be treated, and I was very impressed by how our heads of state know the subject, and unlike myself as a technician, can speak about it without using a script. So we do have very good leadership on the continent. Through the First Ladies and through the ministers who are here, I'd like to commend the African heads of state for their very strong participation last year at the UN General Assembly at the high-level meeting that was held on non-communicable diseases, including cancer. We from the African region were encouraged and inspired by the determination of our leaders to address these problems, which have hitherto not received sufficient attention. It is clear that the message went home to our heads of state. They are doing something concrete to address non-communicable diseases. At the same time, I can share with you that from WHO, we see heads of state giving instructions to their prime ministers and to ministers of health to make progress on universal health coverage. They have decided, and we have first ladies here from countries where the presidents have included universal health coverage as part of their political agenda as priorities. We are working from WHO with many health ministers who've been given instructions to improve financing for health, to improve making the case to ministers of finance for investments in health, because heads of state have understood that it is fundamental for socioeconomic development. And what we need to do is to make sure that cancer finds its place at a very high level of priority in the financing for health, in the training of healthcare workers, in the provision of infrastructure, in the procurement of equipment and medicines, so that we can have the technical platform that is needed from the very peripheral primary healthcare level, from the community level to district hospitals, and then to specialized hospitals in the capital cities, which we make sure that each and every citizen who needs treatment can have access to, something which is not always very easy. We are here in the country of the president of Niger, who is the champion for the continental free trade area and integration of economies in Africa. I think we heard, we congratulate the president for his leadership in this challenging area, which is absolutely essential for Africa's development. And it was already emphasized, and I'd just like to echo, that as a continent and as regions, we can share our resources so that if one country does not yet have the treatment centers that are needed, its citizens can benefit from a neighboring country, something that I know is already being started. I would just like to echo the strong words said by President Idris Deby. And we will convey the message to our colleagues in the African Union Commission, and we will work with them in order to realize this dream of sharing not only economic opportunities, but also the facilities and resources for health that are available on the African continent. I'd just like to leave a couple of messages for the heads of state, for the first ladies, for our leaders in health and in development. First of all, we urge from WHO all countries to commit to universal health coverage as a priority for health, because we believe strongly This is how we will overcome our barriers. This is how we will have efficiency in the use of the resources that are allocated to health, and this is how we'll have equity in access to preventive and treatment services. Secondly, I urge that we prioritize cancer, because looking into the future, it is going to become one of the worst health problems that we have. And we start implementing the tools that are already available from WHO and other partners, integrating them into our health systems. And thirdly, I would like to make a plea for our African First Ladies to intensify your advocacy for health across governments, the private sector, philanthropic foundations, and other partners to make sure that we progress and we achieve the Sustainable Development Goals, within which will be universal health coverage and within which will be the work on treatment and prevention of cancer. I'd like to end by assuring all of you that WHO, at all our levels, in the country offices that work with all of you, at the regional level and in headquarters, are ready and committed to work with our countries, to work with our partners, to realize this dream of universal health coverage, and within that, to stop the evolution of cancer as a killer of African people that we are witnessing today. I thank you very much for your attention.
Thank you very much, Dr. Moeti. Thank you for your message. And you make a very important point about universal health coverage as a way to address equity and stop the spread of cancer in Africa, and also decentralizing efforts. I think that's a very important point that you made there, and I hope your message will be heard and relayed to the African heads of states throughout the continent. Alors, on va continuer.
We shall proceed, and as the First Lady said in her speech, every progress that has been made in the area of cancer control in Niger and other African countries could not have been possible without the commitment and support of our partners, important partners, including the International Atomic Energy Agency that finances health centers here in Niger. And I have the honor of giving the floor to Professor Shaukat Abdurazak, who is the Director for Africa for Technical Cooperation and representative of the Director General of the International Atomic Energy Agency.
Good afternoon. Your Excellency, Dr. Malika Youssoufou, the First Lady of Niger, Excellencies, First Ladies present here, Excellencies, Ministers, distinguished guests, ladies and gentlemen, I'm delighted to join you today on behalf of the International Atomic Energy Agency. I wish to convey the special greetings of Mr. Yukiya Amano, Director General of International Atomic Energy Agency, to all of you. He wishes you a productive and successful conference. I commend the government of Niger and its First Lady, Her Excellency Dr. Malika, for hosting this Ministerial and First Ladies Conference on seeking ways to address the cancer burden in Africa. I would like to express to you the gratitude of IAEA for this invitation. Ladies and gentlemen, I would like to commend Niger for extensive work you have done to finalize the construction of your first radiotherapy center. The IAEA is pleased to be part of this endeavor, for which you have been involved from the planning phase. The National Center for Fight Against Cancer was built by the government of Niger with 2 radiotherapy bunkers. The 2 bunkers will accommodate a Cobalt-60 radiotherapy machine in its first phase and an advanced linear accelerator for cancer treatment in its second phase. The IAEA has supported training for the team of highly specialized specialists who will staff the center and provided the expert mission to assist in the establishment of the life-saving facility. And earlier, we had His Excellency the President of Chad emphasizing the importance of capacity building and the importance of training. And this is why the IAA put a lot of emphasis on this to ensure that we can be able to train our own that will be able to manage and effectively use these machines to treat the patients in this continent. The IAA, through its technical cooperation program, supports its member states to meet its needs, its obligation to 2030 agenda for sustainable development with a range of nuclear science and technology application. We provide expert assistance in important areas such as human health, food and agriculture, safety, water and the environment, among others. Human health is one of the IA's highest priority, particularly promoting the use of nuclear techniques in cancer diagnosis and treatment as a part of comprehensive cancer control plan. Ladies and gentlemen, cancer is one of the leading causes of death globally, and presidents this afternoon reminded us, the First Lady equally reminded us, and my sister from WHO. In 2018, an estimated 9.6 million people died from this disease, according to the International Agency for Research on Cancer. 70% of who lived in low and middle income countries where access to services is limited at best. 23 countries in Africa alone have no access to radiotherapy, an essential tool in treatment of cancer. Reducing the burden of this disease is a challenge which continues to get more difficult, but it must be addressed. And the good news is that the IAEA is working with so many African member states to address this challenge. At least 1,000 more radiotherapy machines are needed on the continent to meet the current demand, and about 1,500 by 2030. Even in countries where radiation medicine technology is available, conditions such as poorly coordinated referral systems, limited national coverage, insufficient capacity, and underskilled workforce, inadequate equipment, or lack of safety regulatory infrastructure is still a challenge. Ladies and gentlemen, the IAEA plays a pivotal role in fight against cancer in Africa. We make radiation medicine and technology available to member states looking to establish or to expand cancer services. Assistance is provided to enhance capacities of medical staff through education, training in areas of radiation oncology and nuclear medicine, as well as assistance in procurement of equipment through government cost-sharing arrangements. The IAEA supports its member states' effort to plan and raise funds for its projects by helping to develop bankable documents detailing the requirements for the construction of physical infrastructure, staff training, and procurement of equipment for their radiotherapy facility, which can then be submitted to potential donors and financial institutions. And I'm sure there are quite a number of potential donors and financial institutions here who would be more than happy to work with us and the member states so that we can collectively address this issue of cancer in Africa. The IAEA also assists member states to develop their national cancer control plans. Impact review missions, for example, assess the status of countries' comprehensive cancer services and offer recommendations on how to make progress. Improving access to effective cancer services in African countries requires the commitment of the relevant national authorities, particularly the ministries of health, finance, and planning, to develop secure resources and implement its cancer control strategy. Ladies and gentlemen, in conclusion, I would like to once again express the gratitude of the IEA to the First Lady of Niger for organizing this important conference with a high-level representation from the First Ladies, ministers, of various ministries, and also other partners. I am grateful to all our donors and partners for their support to the IAEA work. This conference will enhance awareness of the burden of cancer at the policy level, which is important to help further improve the early diagnosis and treatment of African cancer patients. We commend all African countries for the efforts in addressing the fight against cancer. The fight against cancer needs a consolidated approach. It requires transformative leadership, and also it requires champions. And today I have witnessed in this meeting that we have champions among the presidents and we have champions of the First Ladies. The IAEA will continue to work with you to support your efforts to improve cancer services on the continent. I thank you so much.
Thank you very much, Professor Shaukat Abdulrazak from the International Atomic Energy Agency. Thank you for your support in addressing the challenge of cancer in Africa. Thank you very much indeed.
Merci beaucoup, Folie. Mesdames et messieurs.
Thank you very much, Foley. Ladies and gentlemen, as you must all have noticed, we are behind schedule. And now we have two panels. One panel that will be discussing coordination, prevention, and management of cancers in Africa, and another one on financing. The two panels are going to be merged. And to the panelists, we're not going to have any PowerPoint presentation, and we're requesting you to kindly respect the time allotted to you, which is 5 minutes. For those who could even reduce and just give us the main points of their message in 5 minutes, we will thank them in advance. I'll call on the first panelist, Professor Jean-Paul Demieux, Professor of Cancer from Paris. Demieux will talk to us about coordination of the fight against cancer in Africa. The second panelist is Abdulaziz Kassé from the Sheikh Anta Diop University of Dakar, who will be talking to us about the prevention of cancer.
Thompson Farmwork from the Convention Alliance, Francis Thompson from the Farmwork Convention Alliance, qui va lui nous parler de la place de la société civile.
Who will talk to us about the place of the civil society in the fight against cancer. And also among us, we have Dr. Toledano Allah, who is a cancerologist, director of the Cancer Institute, ASMAN, and who will be talking to us about the management of cancers in Africa.
We'd like also to invite here at the podium Dr. Mansour Mukhtar from the International Bank, the Islamic Bank of Development, who will talk about les fonds publics et la mobilisation des ressources.
Public fund and resource mobilization.
Souera Youssoufou de la Fondation Aliko Dangote, qui nous parlera des mécanismes innovants de financement.
We'll talk about innovative funding mechanisms. Please join us.
On the podium, everyone is here? Perfect. Thank you so much. Donc, nous allons commencer avec le...
So we shall begin with Dr. Jean-Paul Demieux. He is a professor in cancerology at University Hospital of Paris, and he will talk about cancer situation in Africa. Thank you. It's a challenge to be able to talk about the subject in 5 minutes. I'm going to improvise, and let me begin by thanking President Issoufou, who has welcomed us on so many occasions in Africa, and particularly in Niger, and also thank the First Lady, Madam Malaika. We've worked with her a number of times, and we'll still be working together in the days ahead. And also the Minister of Health in Niger. We've had regular sessions with him and representative of various delegates. The subject is obviously complicated because we are asking a European to talk about strategy in Africa. So I'm not going to have the effrontery of talking about so many programs and complicated issues. I'm going to position myself on the African continent with the possibility of looking at human resources and technical resources. And since I cannot talk about everything, yesterday we gave a lot of figures, and it's going to be an exponential growth in Africa. The First Lady has said women who have been affected by breast cancer and cervix cancer, and with men it's prostate. And there is the figures do not reveal the full story because there's given the fact that there is a tobacco use, the figures will be different. So with the statistics, we need to be very careful. But if you look at the maps, which I'll show you, you realize that the incidence rate is much lower in Africa than projected. But but the problem is all cancers are not declared. There's a cancer register, but it's in the capitals that these are recorded, not in the hinterland of the country. And since I'm a teacher, let me try and focus my presentation on the training of medical doctors, which in my opinion is very crucial. I see the efficiency at 3 levels of training. The first level is the field medical doctors. We have said it that screening, prevention are the elements that are more profitable and yet costless, have the lowest cost. So we have to train doctors in the screening. These are ways of training the field doctors. The second level is a specialist, the specialist that we need. Medical imagery, endoscopy, urinary, digestive, who are going to support assisting the diagnosis, and also, of course, the more specific training of anatopathologists, which is fundamental for diagnosis, and cancer specialists, and chemotherapy, radiotherapy or innovative therapy. So all these 3 levels have to be respected if we want to have good strategy. We can't have one level and not the other. And then when the difference was given, we're given the difference between pain and we talked about pain and suffering. Now, suffering for the cancer victim, the cancer patient, for his patients, is so painful. And cancer is a chronic disease, and these days, because of medication, these are people who survive for a very long time. So we have to take into account their social distress, but also their sexual, economic, sentimental pain that they have to endure living with cancer. The last thing, I think Africa currently is at a crossroads. And let's not forget that Africa is the cradle of our civilization. And let me give this example. Between Lomé and Cotonou is 60 kilometers. So there's no point having 2 reference centers. We can have one. We can share between the 2, one for radiotherapy and the other nuclear therapy. And then we also need South-South cooperation among the various states, which is indispensable. And then finally, for teaching, I have experience in immunology, pathology, And I have a professor who came with me. We've been working on the training of specialists in Africa on pathology. And we have a university degree for the various countries. And there are 17 countries, African countries, French-speaking countries, which will be covered. In 9 months, we have trained 139 African specialist doctors, and we have 90 currently training. I came with Teleda. No, we talk about cancerology and a cooperation of that kind nature, adapted. So as the president of the United States, not Donald, the previous one said, yes, we can. Thank you.
Merci, Professeur Dumur. Je suis pas...
Thank you, Professor Dumur. I don't think that you could have done better with your slides. Thank you very much. Let me now call upon Professor Abdelaziz Kassé from Charanta Diop University to make his presentation.
Excellences, Mesdames et Messieurs,
Ladies and gentlemen, honorable first ladies, I would call you mothers of Africa. Ladies and gentlemen, all protocols observed. I will urge you to observe 1 minute of prayers for those who are dreaming about the Africa of tomorrow. Let us symbolically pray for all such people. During this single minute of prayer, 29 people have developed a cancer. 15 have died of cancer. I refuse to indeed display morbid statistics by mentioning millions of new cases, mentioning annual deaths linked to cancer. I refuse to take you hostage, to ask for difficult trade-offs in budgetary allocations of the resources of our continent between wars and diseases, alliances and misalliances of circumstance. Ladies and gentlemen, our first ladies, I'm an old soldier, and I don't have any qualms anymore. I only have minds that are service-oriented. During yesterday's session, I listened to some proposals, many of them, to hand over the destiny of our patients to pharmaceutical companies. But there are only four cancers that can spoil our economic efforts. The first one is called the cervical cancer. The second one is called the prostate cancer. The third one is called the breast cancer. And the fourth one is called liver cancer. 2 women out of 10 will develop either cervical cancer or breast cancer. Unfortunately, if these women were to die, 17 members of their families, of their relatives, will leave a disaster that we cannot cure. Several people in Africa are really in a state. In our millennium cultures, we have urinary and sexual sufferings that are linked to prostate cancer. Virus, food, uncontrolled weight that foster the occurrence of many cancers. In addition to all that, I would like to sell to you a small note of hope. Just one word. Prevent. This can be simplified into 5 points. Prevention of cancer. Fight against harmful exposures, such as smoking in all its forms. Fighting against harmful exposures in all its forms of alcoholism, spirits, alcohol. Thirdly, immunize against papillovirus. All our boys and girls before adolescence. This will reduce by 75% our deaths from cervical cancer, anal cancer, and other genital-related cancers. Ladies and gentlemen, let us look at Australia. Let us look at Australia, which is going to be the first country in the world to eradicate cervical cancer. Let us refuse and avoid any distraction from identity crisis animated by people around immunization against cervical cancer. We're not going to accept that. Ladies and gentlemen, let us turn our look towards Taiwan. Taiwan, an island. By massively immunizing all the population, they have reduced by 75% the frequency of liver cancer. It's been 15 years that we've been trying to do this advocacy to obtain the immunization of children at birth against hepatitis B. We have obtained it. We have achieved that. Ladies and gentlemen, I gave you 5 measures. It would be easy to take any of these measures, any of them. It will not work. The ideal would be that every country, each of our countries, commits to a plan, a national plan for the fight against cancer. This plan should have 2 features. This plan must be financed. That plan must be assessed and evaluated. Jean-Marie Dangu has done one. Abdul Aziz Kassé has done a second one in Senegal. Mamadou Diop has done a third one. They were neither financed nor assessed. So the day has come to refuse this type of thing. Women of Africa, mothers of Africa, if you were to decide to carry on your backs all Africa's children in order to immunize them against hepatitis B at birth and against HPV at the age of 10 years, you'll do better than any Nobel Prize for Medicine.
J'entends la voix.
I'm hearing somebody's voice asking me to do something else. Your Excellencies, I apologize for my usual speech, but since 1975, I cannot temper myself, I cannot contain my willingness, I cannot communicate my passion on this matter. We need, once again, to find in our households, in our policies, the means for financing these projects. Nobody, including in international development, can do it in our place. It is incumbent on us at one point or another to find the means through innovating financing by taxing tobacco, by taxing alcohol, by taxing salted food products, sugared food products, and by taxing oily and fatty food. If you think, madam, that these are just intellectual elucubrations, then forget everything I've said and may God keep Africa's country. But if, on the other hand, you believe that these are some of the measures that will give us a better Africa tomorrow, because as long as we dream together, we shall achieve something. It will be the beginning of our realities. The day that we'll dream together, it will be the beginning of our reality. And I thank you very much. Thank you, Professor Kase. What a passionate speaker. Yes, passion. He needed to express himself. Thank you very much for everything that you said. And I think that your message has been heard by our first ladies and all who are here. And this is a contagious passion. Thank you, Professor Kassi. Thank you a lot.
On va parler de la prise en charge des cancers.
We'll now talk about the position of civil society in cancer with Francis Thompson, Farm Work Invention Alliance. Francis Thompson. Yes, let me make a slight correction. It's a Framework of Convention Alliance. So, thank you. I'm very honored to be here and participate in this very important meeting, particularly in the presence of men and women of states from all over Africa. It's very difficult to take the floor after Professor Kassi, but I'll do my best. I represent the international civil society, including many member organizations in Africa, and we've been working for several years now on the implementation of the WHO Anti-Tobacco Convention on Public Work. Why do I want to talk about tobacco? Because tobacco is the #1 global cause of cancer and also other diseases. And from our own experience, I think there are a number of things that we can do and that we should do. And they're expensive. That is to have hospitals, to have high-level technology. But there are other things that do not cost so much, which are not expensive at all, but which require a lot of political will. And that is where the role of the civil society is very important, because behind tobacco use, there are other risks. Behind tobacco use, there's an industry, and that does the promotion, and which is also trying to go around all the efficient measures against tobacco use. Let me also take the opportunity to warn you against the tactics of the tobacco industry, which is funding a foundation without smoking. It is funded 100% by Philip Morris, which is the largest international, the largest tobacco manufacturing company. And this is not acceptable either for governments or researchers. So let me now talk to you briefly about tobacco tax, because that is the perfect example. And if it is an example, an experience that has worked well in many countries, when it is done, the number of smokers go down, the diseases go down, the number of young people who use tobacco also goes down. And the advantage of increasing tax on tobacco or other products that cause cancer is that in the short term, the state can also go and will get some revenue. So it's a revenue that does not only does it not cost much, but it also brings money for the state. And why it is not applied universally? Generally because the tobacco industry is against it, and they claim that it does not work about that it would bring about smuggling, uncontrolled smuggling. But the example in many countries has shown that this indeed is not the case. So people can publicly talk about this case and the experience of various countries. And we of the civil service are here to help you and help you make progress. At the end of the day, it is the state that has to take care of the tobacco use problems. And I'm saying this because I know there are representatives from various African countries here. If you haven't done it yet in your respective countries, you need to adopt a law that would ensure the implementation of the international convention in your country. And this needs to be applied rigorously and strengthen it. We can do something against the increase of tobacco in Africa. We have to act on the risk factors, and we have to do that now. Thank you.
Merci. Merci beaucoup, Francis.
Thank you very much, Francis, and thank you for raising this problem of the interference of the tobacco industry, especially in the presence of our First Ladies. Honorable First Ladies, you have been the target of the tobacco industry. So Francis has given us some hints as to how to counter this interference that we are now being subjected to in our countries. I'd like to give the floor to Dr. Pauline Alain, who is the director of the Ackman Cancer Institute in France, but he's a friend of Africa and who is very familiar with what is happening with respect to the fight against cancer in Africa. He's going to talk to us about management of cancer in Africa. Thank you very much. I would like to thank the President of the Republic, His Excellency Mr. Mamadou Issoufou, and Dr. Malika, the First Lady, for their invitation to this wonderful initiative. I'm expressing myself on behalf of the French African Association of Cancer. So many of us are ready to take up the challenge, not only for prevention, but also all the attention. My friend John Paul was mentioning an American president that said, yes, we can. But I want to refer to another American president, Richard Nixon, who said that in 10 years we would have overcome cancer. We have not overcome cancer, but he multiplied the NCI budget by 5, and cancer is, first of all, a philosophical and cultural story. If everybody thinks that cancer is not a fatality, just look at how we're educated. Voltaire used to say that the art of medicine consists in distracting the patient while nature is healing him. It is true that in the 18th century, our great thinkers illuminated us, but today, we cannot treat cancer if we don't know that we can cure it. More than 55% of cancers are totally cured. And of course, we have to try to work on the training and education of the population. Cancer is not a contagious disease, it's not a fatality. We know that all these major epidemics like the Spanish fever at the beginning of the 19th century with so many thousands of deaths, but today with Ebola and Zika, that indeed led to a certain rejection of science. And it is true that with the HPV and cervical cancer or hepatitis are born out of contagions or viruses, but cancer is not contagious in 90% of the cases. So we need public action against these diseases. Of course, we have shown today that prevention can enable us to avoid 40% of the cancers. Abdulaziz said this a while ago. Tobacco, we know that by increasing the price by 10%, we reduce the consumption by 6%. We know that it costs $300 billion per annum in the US, direct and indirect costs. Tobacco leads to 17 different types of cancer. Well, 20% of cancers due to cancer is not sufficient, but in any case, obesity, 40% of our American patients were 20% fatty food, ultra-processed food. All these are causes of cancer. But of course, in Africa, we need prevention, but we need something else, because when we consult everywhere in all hospitals, we see these women of 40 years who come with tumors in their breasts, and they know that it is a cancer, and they're going to be told, well, we have to remove your breast, because the classical treatment will be to remove the nodule and do radiotherapy, but we don't have radiotherapy with us. And I would like to appreciate what IAI is doing and all the wonderful work that the WHO is doing to encourage the establishment of these centers, which are quite decisive, because to prevent and to screen are important, but to treat is primordial. So, of course, we cannot just be satisfied with enormous centers in capitals. Unite boutiques and supermarkets. Today, you don't need very big hospitals that are expensive to build. We are capable of having functional units that work in networks. Several projects can be interesting in Africa. The digital platform. We should be able to work with a digital platform that will make countries to collaborate among themselves, and within the same country, information flow with everything that we can do on digital economy, interoperability of our data, storing medical information, and avoid all these shortcomings that we have by way of information, which is costing lives. Research in Africa, well, there's no point going to buy health products that are more expensive from elsewhere when we can develop such in Africa. We know that African populations is 4 times the population of the United States. Today, you have with the Franco-African Association the proposal of a biobank in Africa. There is C5, it is 1% of people here. There are people here that are not going to have the AIDS virus, because family genetics will give us information as to how we are going to treat the genomes and predispositions to breast and ovary risks. So if we act early with women, we can avoid ovary cancers and breast cancers. And of course, we can avoid other collateral damages. It's important to have Africa's own research. It's important to form our own biobanks, our databases, not so that we're not dependent on others. When a giant of American industry comes to buy 3 million genomes in Africa, why in Africa can we do that? We can do it even much more. We have many people who are biologists or molecular scientists on the African continent. Is not very expensive. So what I'm trying to say is that 1 year gained for a country is 4% of the GDP. I'm not an economist, so allow me for these vagaries. That means that when we're investing in cancer today, it's not a budget line for expenditure, but again, if the lifespan in Africa moved from 60 to 75, it's more than $1 billion economized in Africa, and it will indeed finance the health programs of the entire continent. So, and I would like to thank President Idris Deby, who gave us a figure. When a country puts 5% of its GDP for health, it's not sufficient. It's sufficient to pay the workers. OECD is doing about 9%. It is true that when we see African countries that are doing 12% of investment, we know that these are countries where lives are going to be saved, because it is every day somebody will see one colleague who will not be coming to work and who may have died. If in every house, one child's room is going to be closed, we have to know that this is a humanist project that will not lead us to be subjected to cancer's fatality. Thank you very much, Professor Tole Donnell. You say something that is very, very important in my humble opinion. You say that cancer is not contagious. It is true that a lot of cliches around cancer in Africa, and that we need to change our mentalities culturally. Thank you for bringing out that aspect as well. Now we're going to talk about solutions. Now, what are the solutions to alleviate the cost of cancer in Africa? We're going to talk about financing and health coverage for the fight against cancer.
Give the floor now to Dr. Mansour Muhtadar from the La Banque Islamique de Développement.
Islamic Development Bank.
Here with us, and who's going to talk about mobilizing resources. Thank you so much for being with us. The floor is yours.
Thank you. Vous me permettez de parler en anglais?
Allow me to speak in English.
She's Hausa.
Oh yeah, Dr. Mansour. Well, I saw him. I didn't know we were in the same hotel.
Okay.
Me. Photographer.
Wow.
I've got him. I'll get a better. His little brother is also in ADB now.
Oh, okay.
He's a director.
Shasise comes, I'll take her, send it. When they focus on her, I'll take it and send it to Pat. And send it to Pat.
She likes her.
She likes the Africans on these.
Oh yes.
It used to be Femi okay.
Yeah. Femi, I don't even know where Femi has.
She's also.
Is to scale up international support. I think the international community has an obligation, a moral obligation, really, to assist other countries. They have committed to providing resources through their donor development assistance, but that has not been enough. They have not been able to meet the targets. Of course, we appreciate that they have donor fatigue, but the second point to make is that whatever we do, we have to recognize that this is our own problem. So even as I started with that, we don't expect much from them. Therefore, we have to look at ways of scaling up public resources that we have available. And this entails really a big effort towards domestic resource mobilization, including increasing tax revenues, including levying additional taxes which were referred to, tobacco, alcohol, etc., including reducing illicit financial flows that a result of the financial manipulations of multinational corporations. And that we know that the African Union has been focusing attention on, and there is clear evidence that so much money could be freed up to be able to finance this. Now, the third area where scaling up is needed is in relation to partnerships. We cannot do this alone. We need to partner with the private sector. Governments need to partner with the private sector, with philanthropies, with civil society, and other interested groups, pharmaceutical companies. There is a lot of scope for public-private partnerships. And the fourth area is that even if we do all of this, we still need to be more creative in the way we do business. We look at financing. And that in itself entails scaling up innovation in the way we finance development. So innovative financing is key. And I know that this is going to be a subject of discussion for the last speaker, so I'll not dwell on that. But the fifth area that we need to contend with, it's not enough to mobilize these resources. Really, I think we need to also place emphasis on effective mobilization of these resources. So now we need to scale up efforts in resource use efficiency. What that means is that we need to plug leakages and wastages in spending, both in government level, different sectors. We need to reform the subsidy systems that are leaking a lot of resources in some of the countries. We need to look at strengthening public procurement, public financial management systems. We need to reduce corruption. We need to face corruption, attack corruption to be able to free up resources. So that's the fifth challenge that we have to face. The sixth is we need to scale up commitment. Yes, so much has been said about political commitment for this, but I don't think that we are putting our money where our mouth is in many cases. There are a few exceptions, of course. We've had some good practices where some countries are striving hard to increase resources, but in many cases, a lot of money is spent on wasteful military expenditure, and there are lots of other areas of where we could ensure some savings. So that, to me, is very critical. Now, to be able to do that, probably it would help to gain more political support. I think the technocrats or the experts need to make a more convincing case for cancer as a real serious issue, and also as really something that's critical for economic development. So investment case for cancer needs to be made, everybody needs to be made aware of that, including ministers of finance and other key sector ministries, planning, etc. But the last, and I think the most important, is the need to scale up advocacy, high-level advocacy, at both international level, at national level, and at a local level. And in this context, I would like to thank the First Ladies of Africa for being the champions of cancer, fighting cancer. And I want to urge everybody, the international community, other civil society, and other key stakeholders to emulate this. Thank you very much.
Thank you very much, Dr. Mansour Mukhtar. We are now going to hear from Ms. Zuwaira Yusufu, who's the Managing Director from the Dangote Foundation. Thank you so much for being with us here today. Your message, please.
Thank you. Bon après-midi.
Good afternoon. I would also like to begin my presentation by thanking my President Issoufou Mahamadou and the First Lady Malika Issoufou for inviting me to share my perspective on innovative funding in the fight against cancer. Well, for me, the issue of cancer is very personal. My father died of cancer 11 years ago. So it's a disease that I'm very concerned about. And beyond that, it's important to know that the private sector is always ready to collaborate with the government, but the opposite is not always the case. So part of our work is to work with our First Lady sisters to help us in that regard. And I'll explain that there's a limit to what the governments can finance if you look at the figures that have been put forward in relation to funding of health, not just cancer. The gap involved cannot be funded by the states, nor the international financial partners who, even though might be ready to help us, but at the end of the day, for them, it's a matter of finding African solutions to African problems, and that's where I think the African private sector has a role to play. I've heard two people say something about philanthropist Dr. Mukhtar, and somebody said it a bit earlier, that we need to take, to draw some advantage from African philanthropists They have a lot of money, and they are ready to fund these initiatives. Let me give you an example. The In Zimbabwe, one of these philanthropist organizations has contributed 60 million to the budget of the Ministry of Health budget in Zimbabwe. But that amount can do a lot, and a lot of people can use that kind of mechanism. What is important, however, is how to ensure that the private sector, how to bring the private sector to collaborate with the public sector. In Nigeria, we did a lot of things. Partnership of collaboration between the public and private sector. There's one called Private Sector Health Alliance of Nigeria. And the objective of that alliance is to mobilize or pool energies and resources together of the private sector and put it at the advantage or the disposal of health to be managed by our states. And I think that is something we should continue doing. We also fund an organization called African Coalition for Health, ABC Health. It's an organization that has the objective is to bring in partnership to establish partnership in Africa to support health development in Africa. But the reality is that this financial contribution should be able to make an impact or its efficiency. There are a lot of discussions have gone on in Nigeria. And in my foundation, we have discussed the possibility of adding an additional 1% tax to cover the universal health care, because the coverage is very extensive and difficult for the government. So how do we bring the private sector to contribute? And the discussion is about how to manage that money, how to convince the private sector and ensure that the results, anticipated results, are attained. And we think that this has to focus on diseases such as cancer, health, education, and human development. There's a great role that the private sector can roll, but for the private sector to be able to play that role, we need to have a discussion platform which is clear between the private sector and the public sector. The public-private partnership has existed for years, has been effective. And there are examples, such examples in Lesotho, Malawi. We are doing one in Nigeria. So these are the type of things that we can envisage and to have to explore mechanisms that already exist in various other countries that can be replicated here in Niger and on the continent as a whole. So my conclusion will be that if Africans want to take care, cover their own budgets, then between the private sector and public sector, we should be able to find sustainable solutions to our problems, health problems, including cancer. Thank you.
Merci beaucoup, Zouera.
Thank you very much, Zuera Yusufu. I think that we have come to the end of the interventions by the panelists. We are now moving to the third phase of this meeting. And it's with a lot of pleasure that I would like to inform you that we'll now hear the First Lady's Niamey appeal. And for that, it will be the First Lady of Burkina Faso, Madame Adjovi Sika Kabore, who will read out the appeal. Your Excellencies, the First Lady of Niger, Your Excellency, the First Ladies of Africa, my dear sisters, Honorable Ministers of Health, distinguished parliamentarians, honorable traditional leaders and religious leaders, honorable experts and representatives of associations and NGOs, distinguished panelists, honorable guests, ladies and gentlemen, I would like to read out for you the Niamey commitment by the First Ladies of Africa for the intensification of the fight against non-communicable diseases. We, the First Ladies of Africa, meeting in Niamey in Niger on the 6th of July 2019, on the emergence of the summit of the African Union, recognizing the double burden that is forever increasing in the African region of communicable and non-communicable diseases, including cancers and connected incapacities and premature deaths associated with these diseases, noting that non-communicable diseases, including cancer, are linked to risk factors that are avoidable, especially smoking, the harmful use of alcohol, unhealthy food, no physical activity, and in some cases, chronic infections. Noting the fact that the majority of African countries are linked by the Framework Convention on the Anti-Smoking Convention of the WHO, considering that non-communicable diseases, including cancer, constitutes the first cause of death in the world, with 41 million deaths, of which 15 million premature deaths in 2015, convinced that if nothing is done, mortality attributable to cancer will double by 2040 in Africa. We congratulate the organization of this Moscow ministerial meeting on healthy living and the fight against non-communicable diseases, and the United Nations Summit on non-communicable diseases, and we appreciate the role of the leaders played by WHO in the preparation of all these very important events, recognizing that the achievement of the Sustainable Development Objectives requires high-level advocacy with a view to achieving good governance in health and social accountability, recognizing the implementation of the World Plan of Action 2013-2020 of the fight against non-communicable diseases by member states, WHO, development partners, and the civil society, in spite of the financial crisis at the world level at the present moment, noting our previous commitments for the implementation of the Universal Strategy 2013-2020 of the fight against non-communicable diseases and resolution of the World Health Assembly, WHA, A70/A/30/9 on the prevention and control of cancer in the context of an integrated approach with a view to slowing down and stopping or reverting the trend of the cases of cancer, and particularly among the vulnerable groups such as women, the elderly, and children. Reasserting our commitment to reinforce the national health systems, including primary health care as a basis for a global approach in order to achieve equitable health results, considering that all countries that do not carry out research and training is condemned to lack human resources and to importing technologies that are not adapted to their needs. We, the First Ladies of Africa, would like to make an appeal, make a call to the international community, to the African Union, to regional and sub-regional organizations, and to all national stakeholders to support this high-effect initiative in the fight against cancer, to all governmental sectors, to partners and the civil society, to include prevention and management of non-communicable diseases, especially cancer, in their strategic plans for an inclusive and sustainable development. To African actors for a synergy of action in the fight against cancer through the establishment of discussion platforms, monitoring, and the sharing of experiences. To technical and financial partners to support the mobilization and allocation of resources, the development and the implementation of strategic plans for the fight against non-communicable diseases in general, and especially in African countries, especially in the low-income countries. To African countries to foster research in adapted technology and the training of quality human resources to accelerate and reinforce the implementation of multi-sectoral initiatives in order to optimize the use of available resources in the fight against cancer in Africa, and also to have platforms for inter-country and inter-regional monitoring in order to be able to measure the impact. To heads of state and government, so that they can guarantee the leadership in the prevention of risk factors in the area of cancer, especially by increasing taxes on cancer-causing diseases, products such as tobacco and alcohol, and that they shall improve the management of cancer by ensuring the participation of all public sectors in partnership with the civil society, the private sector, and the communities. To national leaders at all levels, so that they can prioritize actions to promote healthy lifestyles, prevention, and support to individual well-being, families and communities in the context of primary health care and community commitments. Done in Niamey, Niger, the 6th of July, 2019, the First Ladies of Africa. Thank you. Thank you very much, Madam. The Niamey call made on this day of 6th of July by the First Ladies of Africa for their intensification of the fight against, we will invite the other First Ladies to come and join with their sister from Burkina Faso for the group photograph.
For the family photo, and we will then end our session today. Thank you so very much for being here.
Yes,
Yes, please join them. Dr. Moiti.